In continuation of tests a man needs to do before he gets married, or tests a man needs to do when there are issues or struggling to conceive, we'll be looking at the various systems that are involved. Now, we want to also find out from this patient if any of the organs are affected. For instance, we want to find out whether there's any history of cough, whether there's any history of respiratory tract infection like cough or coughing out hard sputum that we see in some patients that has respiratory infection, or people that have what we call cystic fibrosis. It's also important for me to know as an obstetrician that to find out whether this man has been treated or whether he has been treated for any form of genital cancer before, like testicular cancer. History of diabetic mellitus is very important because patients with diabetes tend to have problem with erectile function, sometimes have some degree of erectile dysfunction, and the quality of sperm is also impaired. If there is any injury to the spine, like spinal cord injury or fall, because spinal cord injury affects erectile as well as ejaculatory function. Drugs that this patient take is very important. Whether the patient is any form of any antihypertensive drugs. Some antihypertensive drugs tend to affect the quality of sperm. Medications are also key. We want to also find out whether the patient takes alcohol. Alcohol treatment, alcohol drinking are be found to reduce sperm count. That is why we counsel most of our patients to avoid alcohol. Environmental issues like chemicals in the environment, which we have dealt with, occupational exposures like toxins, such as heat and chemicals. Air pollution was also found to be associated with lower sperm concentration, motility. Spermatogenesis and sperm quality are be associated with heavy alcohol consumption. We will not forget to ask whether the patient is on any form of hard drugs, like if the patient smokes heavily, or if the patient is on any form of other drugs. Because tobacco smoking has been found to be associated with decreasing sperm concentration, it reduces the motility, and also affect the genetic abnormality, or as it cause genetic abnormality of the sperm. That's why some patients are prone to having miscarriage. Spermatogenesis and sperm quality are usually affected seriously by alcohol and cigarette smoking. Substance abuse can also lead to impairment and affect the pathway which we call the hypothalamic pituitary testicular axis. So for a man who wants to get married, for a man who is believing God for the fruit of the womb, who is trying to impregnate his wife, when they come around, these questions are usually asked, and we'll counsel them to stop when necessary. So tobacco smoking is something that we should avoid. Alcohol is what we should avoid. And if we do this, chances of having a very good sperm with a good fertilization and good conception will be enhanced. My name is Dr. Ede Edopolo Osazua. I remain the only minister or doctor of hope. Thank you.